How do you get diagnosed with 3PD, also known as persistent postural perceptual dizziness? Well, this video is going to tell you. My name is Amy. I'm a vestibular physical therapist, which means I treat dizziness, balance problems, and vertigo for a living. Like most other vestibular disorders, 3PD has no definitive test that a doctor can run to fully tell them if you do or do not have 3PD. This is because there are no biomarkers in our bodies that tell a doctor whether we do or don't have this disorder. Instead, they have to go by clinical signs and symptoms and patterns over time. A doctor may lean towards a diagnosis of PPPD if you have the following symptoms. Chronic dizziness symptoms that are not described as spinning dizziness, that can wax and wane over time but never fully go away. Symptoms began after a significant life or medical event, such as a divorce, loss of a loved one, or diagnosis of a severe vestibular or neurological condition. Your dizziness symptoms seem to be closely related to your anxiety, and your dizziness symptoms seem to also be provoked by visual symptoms such as busy stores, busy restaurants, too many lights, or busy complex visuals on the carpets or floor patterns. And the sensitivity to visuals does not stop at busy or conflicting patterns, but also goes to the other end of the spectrum to wide open spaces and having nothing to look at. In order for your doctor to diagnose you formally with PPPD, you have to have all four of the following diagnostic criteria. Number 1 is symptoms that are described as dizziness or unsteadiness and non-spinning style dizziness, which is present every day for the last 3 months continuously. Those symptoms could be waxing and waning per day, but they are always continuously present. Number 2 is dizziness symptoms which are exacerbated by any movement in an upright posture, and that can be in any direction when the person is upright, meaning forward, backward, bending, looking up, etc. And symptoms are provoked by moving or complex visuals. Number 3, the symptoms were precipitated after a significant life or medical event, such as diagnosis of a neurological or vestibular disorder, or a significant life-changing event, such as death of a loved one, divorce, or loss of a job, and those symptoms may have precipitated intermittently after this event, but then became constant over time. And number 4, your symptoms cause significant amounts of distress and functional loss, such as being bedridden or having to quit your job. Clinicians who diagnose and treat 3PD include neurologists, neuro-otologists, ENTs, vestibular physical therapists, clinical psychologists, and psychiatrists. To find a qualified vestibular specialist near you, go to vestibular.org, click Find a Clinician, and type in your zip code.